Hello, it's Dr. Jack Krasuski, and today's post is about physician burnout. More specifically, how to avoid physician burnout. Now, you've probably read articles, you've maybe seen it in medical journals or even just in newspapers for the lay public, suggesting that, between 20 and 50% of physicians are in some way unsatisfied or very unsatisfied with their work. And also, you might have read other surveys that show that a large percentage of physicians would not wish their children to become physicians. So, that's not very encouraging news. So I wanted to speak with you today about, how to avoid career burnout in your own life. And I wanted to talk about, what I think is one of the underlying conditions that could lead to burnout and even depression. And that is lack of control. So, some physicians work extremely long hours and they're extremely happy. I've met surgeons who can't wait to spend time in the operating room. It's a real high for them. Just about a month ago, I was speaking with a psychiatrist who works from 7 in the morning to 9 p.m. 6 days a week, and then he even does some stuff on Sunday. But to him, it's like he gets energized by it. So getting physician burnout is not directly tied to overwork or long hours or anything like that. It's related to a discrepancy between what a person would want and what they actually have. And why is there that discrepancy? And it's usually due to lack of control. You feel helpless to change things to make them more aligned with what you feel your needs are, whether it's seeing different types of patients or kind of different work hours or what have you. So in this post, I'd like to encourage you to think about how you could keep or even wrest back control over just your day-to-day life at work, your schedule, things like that. And if you ever find that, that your place of work, whether you're working in a group practice or you're working for a larger institution, if kind of know your power and know that you can negotiate with groups and institutions. There is a relative physician shortage, so I want you to know the power of your negotiation stance. And I'll talk more about negotiation techniques in upcoming posts. And also, feel free to explore other opportunities. One thing that I find is that physicians often are quite, feeling trapped in their position. And as I had mentioned in an earlier post, when I learned from this physician consultant, Bob Purdy, that when he was consulting with physicians who wanted to make a career change, that he found that most physicians actually didn't want to change their careers. They wanted to continue to be physicians, but just have a different way of practicing. And so feel free to explore, feel free to, to take steps to maintain your control or even wrest it back, because that will prevent burnout. Before I sign off, there's one concept I wanted to tell you about. It's called learned helplessness. So in the mid-20th century, psychologists discovered and then articulated this concept of learned helplessness. And it was developed, this concept, in studies of rats. And, they would, kind of like if you have rats in the maze and you shock them under certain conditions, they will learn obviously very quickly to avoid that condition, that direction of moving or whatever it is. But then they started shocking these rats kind of randomly, and then these rats would just basically lie down and not move even when they were shocked, because there was no predictability, there was no control. These insults, physical insults, were coming randomly, and they had no way of planning, of counteracting that. And they developed, for all intents and purposes, depression. So, kind of lack of control can lead to learned helplessness, and that could even lead to clinical depression. So please feel free to engage with me in a discussion. I'd like to hear from you, your own challenges about having that control that you would like to have, and also some stories where you were able to achieve that kind of control, kind of like success stories. So thanks so much for engaging with me on this, what I think is a very important topic for physicians. Signing off, this is Dr. Jack. Thank you.